So, this week's topic is going to be medical terminology related to the human eye. Here we have a picture of the anatomy of the eye. The eyeball is an organ of vision. It's located in a bony protective cavity inside the skull called the orbit. Only the anterior aspect of the eye is visible from the outside. The rest is in this protective cavity. And here on this picture, we have some terms listed for structures of the eyeball. So first off, the sclera. The sclera is the outer protective layer, the white part of the eye. And then the cornea is the anterior aspect of the sclera, which is see-through, that lies over the front of the eye, over the iris, and allows light to enter. You have the iris, which is the pigmented muscular structure that regulates the amount of light that enters the eye by controlling the size of the pupil. So it opens and closes to allow more or less light in. And it's the colored portion of your eye. So if you have blue or green or brown eyes, the iris is where you get that color. Your pupil is the opening in the center of the iris. The lens lies directly behind the pupil, and its function is to focus and bend the light that enters. Your retina is the innermost layer of the eye, which contains the vision receptors. So light passes through first the cornea, then the opening or the pupil. It's bended by the lens, and it hits the back of the eye, which is the retina, and that's where the images are first taken in. The macula is a small portion of the retina at the back of the eye, responsible for detailed central vision. And then you have your optic nerve, which carries those visual impulses received on the retina back into the brain. Your aqueous humor. Aqueous humor is a watery liquid in the anterior cavity of the eye. It provides nourishment to nearby structures and maintains the shape. The vitreous humor is a jelly-like substance found behind the lens in the posterior cavity of the eye that maintains the shape, keeps it nice and circular. And your conjunctiva. Conjunctiva is the mucous membrane lining the eyelids and covering the anterior portion of the sclera. So here we have a visual of the outside of the eye, what can be visualized. So you have your eyebrow, obviously, your upper and lower eyelid. Your pupil is the dark spot in the middle of your iris, which is the colored portion of the eye. And then your lacrimal caruncle, this is like a tear duct. And your conjunctiva. Conjunctiva is the membrane that covers the eye. And here we have an image of like tear production. So lacrimal glands or tear production glands. This is where we form tears, and they're used to keep your eyes hydrated and possibly remove any foreign substances. So lacrimal gland will secrete tears out of the lacrimal duct. They'll pass across, they'll lubricate the eye, and then eventually they'll leave through this lacrimal canal and the lacrimal sac, and then they enter into the nasolacrimal duct, and you swallow your tears. So that's why when you start crying, you get a runny nose as well. Combining forms for this chapter. First off, ophthalmo means eye. Opto is referring to vision. Pupillo is pupil. Retino, retina. Sclero, sclera. Diplo, two or double. Myco, fungus. Photo, light. Zero, dryness. There are definitely some more in the chapter, so this is not all of them. Prefixes for this chapter. A or an means without. Bine means to. Indo or intra is within. Those should all be review from some previous chapters. And then suffixes. Algia, that's a repeat, means pain. Meter, instrument used to measure. Opia is referring to vision. Osis is an abnormal condition. And phobia is fear of or aversion to. Plesia or plasia is paralysis. And we have some disease and disorder terms of the eye. So blepharitis is an inflammation of the eyelid, pretty common ailment. A lot of people get it, typically from a little local infection or bacteria, dirt, something getting into your eye. Conjunctivitis is pink eye, inflammation of the conjunctiva, also pretty common. Diplopia is double vision. Iritis, inflammation of the iris. Ophthalmalgia is pain in the eye. Retinoblastoma is a tumor developing from the retinal cells in the back of the eye. Retinopathy is disease of the retina. Common one is diabetic retinopathy, so it's disease of the retina related to complications from diabetes. Xerophthalma is dry eyes. Some more disease and disorder terms. So a cataract is a clouding of the lens. A chalazion is an obstruction of an oil gland of the eyelid, non-infectious obstruction. Glaucoma is increased intraocular pressure. So the pressure within the eye is higher than normal, can lead to vision loss if left untreated. Hyperopia is farsightedness. Myopia, nearsightedness. Presbyopia is impaired vision as a result of aging, so just bad vision as you get older. And stye is an infection of the oil gland of the eyelid, also called a hordeolum. There are definitely more disease and disorder terms to be reviewed in the chapter, so read the book. Surgical terms for the eye. Keratoplasty is a surgical repair of the cornea, or more often a corneal transplant. Enucleation is the removal of the eyeball, so taking the eyeball out. LASIK is an acronym, laser assisted in situ keratomileusis, or the reshaping of the cornea using a laser to improve vision. It can be used for treatment for a lot of different visual disturbances: myopia, presbyopia, stigmatism, pretty much you name it. They use LASIK for that now. Scleral buckling is a surgical procedure in which they reattach the retina after partial retinal detachment. Trabeculectomy is a creation of an artificial opening to drain out aqueous humor used to treat glaucoma or increased pressure within the eye. So they make a little opening to allow some of that fluid to drain out to maintain a normal pressure. Diagnostic terms for the eye. So keratometer is an instrument used to measure the shape of the cornea. An ophthalmoscope is an instrument used to visually examine the eye, the anterior aspect of the eye. Optometry is measuring vision and visual processing. A tonometer is an instrument used to measure the pressure within the eye. And a slit lamp is a mounted microscope used to examine the eye and the internal structures. And lastly, we have some abbreviations. So AMD is age-related macular degeneration. Astigmatism, abbreviated AST. Intraocular pressure is IOP. VA means visual acuity. LASIK, we talked about, laser assisted in situ keratomileusis. And ophthalmology, OPHTH. Tough one.